down here. You need a reason to move. Feel a fool.
Good morning again, John. Nice to see you. I see that you got a little trim on top there. That's very cool. You know, the world seems to change every single day, and we now know that the world has continued to see increasing cases of documented cases of the coronavirus. We hit 3 million cases yesterday, and that's a big deal. And we know that it took 3 months to hit 1 million cases in the United States. It took 44 days to hit 2 million. It only took 26 days as of million. And the Sun Belt's taking it on the chin. Places that have air conditioning, I think, not coincidentally. And you're planning a career in emergency medicine, starting medical school in about 3 days. Emergency departments are their own hot spots. What's happening up in Tennessee? And what is your understanding of some of the smaller, more rural hospitals and areas that don't have the same resources, medical resources like we have down here in Florida, that New York has? How are you going to kind of move forward with this?
So that's obviously everyone across the nation. The concern whenever we first heard about COVID was the availability of beds, right, and ventilators. And I think that is a concern that is really acute in the area that I'm in. The medical school that I attend actually has a big part of its mission is rural medicine, rural primary care. And that's actually a track that some of the students can go into. One of the hospitals that we service literally has 2 beds. It's that rural. It's a 2-bed hospital. So when you think of places like that, it's a massive concern for. Tennessee is one of the states that has increased. You know, we are not seeing that plateau. We're seeing cases continue to increase. So I think that is, you know, the bigger hospitals and more populous areas obviously are at greater risk for spreading the disease. But at the same time, if it does get to these rural areas, kind of like we saw in Indiantown out in Florida, it could be catastrophic.
There's a lot about airborne aerosolized particles. The World Health Organization has commented that they'll be providing a report soon, and there's a large group of scientists, and certainly all of us share the concern of this evolution of information and learning about the coronavirus's way that it's transmitted.
Mm-hmm.
What's your understanding of this evolution of information about aerosol particles?
Again, I wouldn't presume to be an expert on the transmission of the disease, but yeah, with new information that is showing how the disease is perhaps evolving, or whether it's just we're gaining more insight into it, it is concerning, because even the relatively simple measures that the CDC has outlined, like wearing a mask, is problematic for a lot of people. So I guess the question is, even if is a mask going to be sufficient eventually?
You know, we have a shortage of respirator masks, the N95s, and I can speak personally to that shortage. Is very real, and it's affecting some doctor offices reopening. It's affecting hospitals, emergency departments, and it is understood that an N95 respirator mask is designed to protect the user from breathing in the very small particles that can contain the virus.
Right.
The standard surgical mask, the one you and I wore when the 150 cases where you were my surgical assistant,
Right.
aren't designed to protect the user from breathing in contaminated air. It's simply designed to prevent the exhalation of particles and droplets.
Mm-hmm.
So without an N95 respirator, face masks, while important, and they do decrease to a certain extent this transmission, they're not the end all that is out there. And right now, if you went on and tried to buy a set of N95 masks for you, your fellow medical school classmates, and your family, you wouldn't be able to, in my
Right.
experience, having tried to do that in the last few weeks.
Yeah.
How are you going to approach going to medical school on Monday with a lot of people, some of them are younger than you? You know, you'll be one of the mature students, Jon, and yeah, they might still be going to bars and going to sandbars and going to the beach and going on crowded areas and coming from homes that are multi-generational, where there's young, middle-aged, and old people together. How are you going to approach medical school next week, other than the virtual classes? That is its own set of issues with you and your rambunctious youngsters running around the house.
Right. Well, I think my school is taking steps, really proactive steps to prevent, obviously being a leader in the area. If you're a medical school, the community kind of looks to you for leadership, I think. So we kind of have to be the shining example of how to adhere to the guidelines, even more so than the rest of the school. I actually, since we've last spoke, I got given my own situation where I'm going to be trying to study with children. I got authorized to go into they're doing case by case authorizations to go to the student study center. But even with that, it's required you have to wear a mask. Now, not an N95, obviously, because they're in such short supply, and I have to wear a mask, and we have to decontaminate the entire area when we've left. We're not allowed to set up shop. So they're taking it seriously. But obviously people need to kind of continue to pursue their career in medicine and study. So yeah, it's going to be a challenge for schools, but sorry, I've got a rolled at the door. But yeah, it's going to be a challenge, but it's I think the schools can only do so much. But to speak to the issue of N95 masks, it's true. Around here, half the time you see somebody wearing a quote unquote face mask, it's a bandana. We know that does very little, especially if it's aerosolized.
You have a day to think about school reopening, talk to your wife, and observe your children running around like hooligans, I'm sure.
Yes.
And any more thoughts on what you guys will be doing or what you hope happens with school reopenings there in Johnson City, Tennessee, and also, and for the rest of the country, your thoughts on the advisability, the planning, should there be a national strategy? Is it going to be school district by school district? What's your take on that now, Jon?
It's a fine line to toe, because obviously as a parent who's, had their children home for an extended, for months at this point, you see a child's need for that stimulation that they get at school. That's really important for them. And I think that they miss that, and they miss that connection. And obviously parents need to go back to work. So there's this desire from maybe a selfish standpoint that you hope that your child can just go back to school because it makes life easier. But that's obviously towed with, safety, the concern of safety. And there's even in my, I actually have a neighbor who's a kindergarten teacher who's been feeding us information. on what she's hearing from the school district. And, you know, they're saying maybe they're going to reopen, but require children to wear masks and try and social distance their desks and stuff and such. But the reality is, I know my 6-year-old and my 3-year-old, telling them to keep a mask on for 8 hours a day is pretty much impossible, right? And telling children to go out into the playground but don't touch each other, again, they're not going to listen to that. So it's difficult. I think it should be school district by school district also, because obviously different parts of the country are not affected the same. But with that, there needs to be, the school districts need to keep a really close ear to the ground, I believe, to try and see how the cases are in the area and be willing to change if necessary.
Veteran healthcare is always on the top of our minds. And what's your understanding, especially there in Johnson City, where there's a VA system that's very robust?
Mm-hmm.
How are the veterans being managed now as it relates to coronavirus and all the other health problems that can be exacerbated by this pandemic and isolation and mental health problems?
Mm-hmm. Yeah, I mean, we have an aging population, and we have a large, the veteran, the VA system serves an aging population. You know, anytime I have to go there, which I've had to go there for med school physicals and such. So there's a huge population that requires regular care. I do know that at least the VA system here, it wasn't until June 15th where they were actually seeing patients face to face. Prior to that, it was all virtual medicine. And even now, if you have an appointment, they are still giving the option to have virtual encounters, which I think is a good thing. But it is a concern because there's a lot of veterans who still require care, and that care is both physical medicine, but also mental health. You know, you're dealing with a population that has that is are more prone to things like PTSD, depression, and substance use disorders because of the nature of what they have to, you know, what a veteran goes through in their time in active duty. So it's a concern, and I think the VA is doing what it can, following guidelines. But it's I don't know how it is in the rest of the country, but it's definitely feeling the challenge.
Yeah, you were active duty only a few years ago, and you're probably in communication with some of your friends and buddies and fellow corpsmen. What are you hearing about how active duty service members are being managed? You don't get much in the media about that.
Yeah, really, for the most part, I know that the military has the ability to, I know that they've restricted travel to certain states, which are considered hotspots, so that there's been federal control to that extent. But really it's difficult because the military has to continue to function and operate, but so much of what you do on active duty is it's very hard to social distance while doing it and go through training. I thought you just think of boot camp, where, you know, you're packed into a berthing where everyone's kind of literally on top of each other in bunk beds and things. And how do you do that? How do you get people from literally all over the country and bring them into the same berthing? And it kind of sounds like a recipe for disaster as far as the transmission of COVID. But yeah, again, unique challenges that everyone has to face.
Vaccines are the holy grail that we're all hoping for and even expecting. And immunizations, while they may not be the final answer. They'll take us a long way toward drawing down this pandemic. Childhood immunizations are taking it on the chin. You are a parent and you've got kids and you have other friends that have kids. How is this pandemic affecting childhood willingness to have childhood immunizations when no one wants to go to the pediatrician? No one wants to go outside the house and let your kids be exposed. What do you see happening? And we have flu season coming up.
Right.
Flu vaccines, that first shipment should be coming out here at some point. What's your take on where we are with vaccines, both for the coronavirus and for the flu and childhood illnesses?
Right. Well, I mean, I think we've seen, there has been that kind of anti-vaxxer push in previous years. It would be interesting to see, I mean, the medicine doesn't support that. We know that vaccines are warranted and have eradicated diseases. I think there will probably be a continued willingness from parents, maybe some who were apprehensive beforehand, to get their child immunized should an immunization present itself for COVID-19. I think maybe out of even necessity, right? I'm sure schools today are allowed to require immunizations unless, I believe, for religious reasons and such. That's the only way. But a child needs to be immunized before they start the school season. So I'm sure out of perhaps even out of necessity, children will need to be immunized with COVID-19 if that becomes available before they can go back to school, at least.
We just learned yesterday, as I said earlier, that we hit 3 million cases in the United States. And the CDC, Dr. Redfield had reported only a week or two ago that we're only counting 1 out of 10 cases to be documented. Dr. Gottlieb, the former FDA commissioner, just reported that we're only counting 1 out of 12. So in reality, if you do the math, it could be that we are seeing 500,000 cases a day. And fortunately, the average age, again, Dr. Fauci has reported the average age of somebody that shows up positive is 15 years younger than it was just a couple months ago. We also see that we just had the biggest increase ever reported by a country in a single day this week. So this pandemic is really blowing up across the country, particularly in states that have air conditioning, the Sun Belt. And what's your broad view of this, John? You're entering a field right now, starting Monday, that's the backbone of public health and medical care. What's your broad take on this before we go?
I think there has, when you do hear statistics like the average age is 15 years younger and that we're only counting 1 in 12 cases, and I think it's legitimately concerning. That may seem like an obvious statement, but why it's legitimately concerning, in my opinion, is that there's definitely, I'm seeing nationally, there's kind of this attitude that everything's getting better, as businesses continue to reopen out of necessity. And they're trying, I know a lot of businesses are trying their very best to, practice social distancing and things, but I know when I'm out and about, whether that's just at the grocery store or what have you, there's a general lack, there's kind of a disregard for things because it's been going on for so long and businesses are opening. So people assume that things are getting better when they're really not. And I think it's kind of, it is a troubling sign, because the reality is things are getting worse and worse, but people are acting like they're getting better. And that's concerning to me. I think, some people who are maybe resistant to it, sadly, it may not be until a family member or a close friend becomes positive and is seriously compromised from the illness before it becomes a reality for them. Sadly, that's how some people learn. And that's not to say that everybody's just disregarding social distancing guidelines. You can't generalize it to that extent. But I think for people who maybe are disbelieve or are suspicious of the statistics, it may need to be someone dying that they know before it really sets root that this is not a joke, and that we need to continue to protect ourselves and protect humankind, essentially.
The disproportionate impact of this pandemic and some other public health measures on the Black community and the Latino community has been well documented. And you and I are obviously white. In Johnson City and areas here in Palm Beach County in South Florida, there's a very large Black community and Latino community that have disproportionate increasing a number of cases, are working perhaps in areas that have less room or ability for social distancing. And you've studied this, I know, in your experiences for the last 10 years. What do you think the country can do, and what can we as individuals do to try to improve that reality of racial disparities and ethnic and minority disparities in this pandemic, if not in other measures of society?
Yeah, racial disparities have been kind of, fortunately, they've been in very acute observation, especially with the Black Lives Matter movement, with the murder of George Floyd, and that kind of caused a social awakening to an age-old problem. Racial disparities within healthcare are well documented, and yeah, we are. The statistics are showing that ethnic minorities are being affected by COVID-19 far more severely. The reason for that, I mean, again, I don't presume to know the answer, but what a lot of it I know is pointing to is already because of lower socioeconomic status. African Americans, for example, are more prone to certain diseases like diabetes and high blood pressure and things that are have shown to be predictors for people to do poorly should they contract COVID-19. And I think the answer to that is obviously a very complex one, but greater representation of African Americans in healthcare is one of those. There needs to be a very comprehensive response to addressing that problem that sadly I don't think we're going to see by the end of this year, certainly. But
all right, I appreciate it. Anything else you want to tell us before we sign off here?
No, thank you for the time.
Good deal.
Oh, Mexico. It sounds so simple, I just got to go. The sun's so hot, I forgot to go home.